Hello everybody, this is Joshua with the Tendonitis Expert. So let's talk about the basics of wrist tendonitis surgery. And let's start with the two scenarios in which you would get wrist tendonitis surgery. The first is if you have damage on tendon. And the second is that maybe you have damage on a tendon. So if you have damage, the only way to know that is if you had an MRI and it saw damage right here, for instance. Or maybe there's a spot where there's a lot of inflammation. And they're assuming that because there's inflammation is because there's irritation and maybe a little bit of microtrauma there. So they want to get in there and smooth off the tendon. So they get rid of all the little frayed bits of the tendon, is the theory. The other scenario is that maybe there's damage. So they don't see anything on an MRI, but you have pain, maybe you have tightness through here and pain in the wrist area and maybe some pain here and maybe some clicking in the wrist or some clicking in the knuckles. And so they think that there must be a physical problem in there that surgery can fix. So they're going to go take a look. And if they find something in there, well, they'll take care of it while they're doing the exploratory surgery. So there's that. So what do they do actually during surgery? Well, in the old days, they would make an incision like so, and they would pull the skin apart that way and this way, and they would look at the tendon and they would clean up anything that they could see. But they don't do that anymore, which is good news because that's really traumatic. Nowadays, they can do arthroscopic surgery, essentially. So while these aren't in the right spots necessarily, they cut a hole right there, they cut a hole there, and they stick a couple long metal instruments in there, one with a camera, one with a cutter, and then they visualize. So they stick the metal tool in there through your connective tissue, and they look to see what's happening on this tendon, and they look to see what's happening on that tendon, and they just look around to see whatever they can see. And if they see some frayed tendon or something, then they will clean it up while they're in there. But if they don't see anything, then they just cut into your flesh, and prodded a long metal tube all through your connective tissue here. And that is what wrist tendonitis surgery consists of. So then the next question becomes, should you get wrist tendonitis surgery? You had pain, you went and saw a doctor, you got a wrist pain diagnosis that included wrist tendonitis, you tried some things, and then the doctor wants to do surgery. Should you get that surgery? That is an important question. So let's look at that. So, in general, I say that doctors don't know how to fix wrist tendonitis. And that's a problem if they want to cut into you and do surgery. Now, why do I make that claim? Here's why. So you had pain in your forearms and wrist and hand, or whatever that looked like, and you were prescribed rest, and you were prescribed anti-inflammatories, maybe splints and braces to immobilize your wrist and support your wrist. And when that didn't work, they did a corticosteroid injection or 2 or 3 over time when that didn't work for very long at best. And somewhere in there they'll prescribe physical therapy, so you do that for weeks and weeks or months. And eventually all that failed to fix the problem. And then the doctor wants to do surgery. So here's the question. If the doctor prescribed rest and that didn't work, and anti-inflammatories and that didn't work, and corticosteroid shots and that didn't work, and splints and braces and that didn't work, and physical therapy and that didn't work, that makes him 1, 2, 3, 4, 5, 0 for 5. So with that track record, why would surgery work? What about surgery would have it work? What about surgery would have your doctor be correct when it was not correct all these times? Because chances are you're going to end up 0 for 6. You might get benefit for a while, but research tends to show, and anecdotal evidence tends to show, that down the line, the pain comes back. That's mostly who I work with. So, are you going to get wrist tendonitis surgery? That's up to you to decide. That's up to you to figure out, and these are some basics for what to think about that. If you'd like to find out more about wrist tendonitis surgery, visit my website, tendonitisexpert.com, and find the appropriate page.